What if I told you that neglecting your penis could silently lead to loss of function, painful conditions, or even cancer, and that most men won't know it's happening until it's too late? I'm Dr. James, a men's health specialist with over 30 years of experience in urology. I've treated thousands of men in their 60s, 70s, and beyond, and I can tell you this: the biggest mistakes most men make with their sexual health are completely preventable. You might think it's all part of getting older, but it's not. In fact, there are 5 simple things no one taught you, that could protect your health, your confidence, and your sense of manhood well into old age. In this episode, I'll walk you through the 5 essential care steps every man over 60 should take to preserve his sexual health, plus a powerful bonus tip that could prevent one of the most damaging conditions men face as they age. And if you stay with me to the end, I'll reveal a quiet nighttime habit that many overlook, but it could be the key to protecting your erections while you sleep. Before we dive in, if you haven't subscribed yet, go ahead and click that button and turn on the bell. This way you won't miss any future health advice designed specifically for men in their golden years. And if this video speaks to you, type 1 in the comments. If not, type 0. I truly value your feedback and want to keep improving what I share with you. Let's begin with one of the most overlooked but absolutely vital foundations of male health as you age: keeping your penis active. Yes, even when intimacy isn't frequent or possible, this one habit can preserve not just function, but your sense of masculinity and vitality. 1. Stay sexually active, even if it's just you. As men grow older, many assume that a drop in sexual activity is normal, and while it's true that hormones shift and desire may lessen, the idea that sex or erections no longer matter is one of the most damaging myths we've accepted about aging. Your penis, like your muscles or your brain, requires regular use to stay functional. It needs oxygenated blood to nourish the tissues and preserve healthy nerve response. When erections stop happening altogether, the tissues can begin to shrink, stiffen, or scar, a process that often goes unnoticed until it becomes irreversible. But here's the encouraging truth: you don't need a partner to keep things healthy. Even if you're not currently sexually active with someone else, masturbation remains a perfectly valid and medically recommended way to maintain penile health. It helps stimulate blood flow, protects tissue, and even supports mood through the release of feel-good hormones. And for men who struggle to achieve an erection on their own, devices like a vacuum erection pump, used just a few times per week, can provide that same essential oxygenation and keep the tissues functioning well. There's also a deeply personal side to this. Maintaining sexual function is about more than just physical ability. It's about preserving confidence, identity, and connection to your sense of masculinity. Too many men allow shame or silence to rob them of years of meaningful intimacy or self-expression. Don't be one of them. Some of my older patients have told me they felt too old to care about this anymore until they realized how much joy and strength they regained by re-engaging with their own body. It's not about performance, it's about presence. Now, if keeping your penis active is about keeping it alive, the next step is about keeping it safe. There's one simple daily habit that could dramatically reduce your risk of infection and even cancer, yet most men ignore it completely. Let's talk about that next. If you're still here and these insights are resonating with you, drop a number 1 in the comments so I know you're still with me. Now let's keep going. What I'll share next is something most men overlook, but it's absolutely critical. 2. Practice daily hygiene, even if you're not sexually active. One of the most basic yet critically overlooked aspects of penis health is hygiene. And no, it's not just a concern for younger or sexually active men. For older men, especially those over 60, cleanliness becomes even more important. As the immune system naturally weakens with age, your body becomes more susceptible to infections, irritation, and even serious conditions like penile cancer. In fact, studies show that poor penile hygiene is one of the top risk factors for this rare but devastating disease, and countries with low hygiene awareness often have the highest rates of it. Proper hygiene starts with something simple, a daily wash. Use warm water and a mild, fragrance-free soap, something gentle like glycerin-based or pH neutral. If you're uncircumcised, it's essential to gently retract the foreskin and clean underneath, where secretions can build up and create an environment for bacteria and fungus to thrive. After washing, be sure to dry thoroughly, especially in the folds of skin, since moisture can lead to irritation or infection. If you have limited mobility or arthritis, consider using a soft sponge with a handle or ask your provider about assisted hygiene methods. It's also important to wash after any sexual activity, whether with a partner or solo. Fluids like sweat, semen, lubricants, or vaginal discharge can alter the natural balance of bacteria on the skin and lead to discomfort or infections if left uncleaned. Even if you think, "I'll do it later," taking a few minutes immediately after can make all the difference in your long-term health. And remember, taking care of your hygiene is not just a routine, it's a form of self-respect. It sends a message to your body that it's still worth caring for, no matter your age or sexual activity level. Cleanliness isn't about vanity, it's about vitality. Now, keeping your penis clean is one thing, but did you know there's a very specific way men injure their penis during sex without even realizing it, and that it could lead to permanent curvature? What I'll share next might surprise you. 3. Avoid sex with a semi-erect penis. It's something most men don't think twice about, engaging in sex even when their erection isn't quite firm enough. Maybe it's out of eagerness, pressure to perform, or simply not realizing the potential harm. But the truth is, attempting penetration while only partially erect puts your penis at serious risk for internal injury. Unlike other muscles or tissues in the body, the erectile tissue inside your penis is delicate. When it's not fully rigid, it bends more easily, and not in a good way. Repeated pressure or bending during intercourse in this state can cause microtears deep inside the shaft, even if you don't feel pain right away. Over time, these small injuries can lead to the development of scar tissue. That's when things become more serious. Scar tissue can harden and form plaques, which eventually lead to Peyronie's disease, a condition where the penis becomes curved, sometimes painfully, during erections. This can affect not only your ability to have satisfying sex, but your confidence and overall sense of self. What starts as a minor incident can turn into a chronic condition that often requires medical treatment or surgery to manage. If you ever find yourself struggling to achieve a firm erection, don't force intimacy. Instead, see it as a signal from your body, one that deserves your attention, not your frustration. There are effective, safe treatments available today, from prescription medications to vacuum therapy and injectable solutions. Many men have regained strong, lasting erections well into their 70s and 80s with the right guidance. The bottom line is simple. Never treat a semi-erect penis as good enough. Your health is too valuable and the risks are too real. Take your time, listen to your body, and seek help when needed. Protecting your function now means preserving your freedom and intimacy later. But protecting your physical health isn't just about the body, it's also about your brain. There's one modern habit that silently rewires your sexual responses and leaves many older men feeling disconnected and numb. And most of them don't even realize it's the cause. Let's explore that next. 4. Limit pornography. Reconnect with real desire. In the digital age, it's easier than ever to access adult content, and for many older men, especially those who may feel isolated or out of touch with intimacy, pornography can feel like a harmless outlet. But what most men don't realize is that consistent long-term exposure to pornography, especially when it becomes a primary source of arousal, can actually dull your natural sexual responses. Over time, it can make real-life intimacy less satisfying, harder to initiate, and even physically more difficult to respond to. Your brain, like your body, is shaped by repetition. When you repeatedly respond to fast-paced, highly stimulating visual content, your brain starts to require that same level of novelty to feel excited. Real human connection, with all its imperfections and slower rhythms, can begin to feel flat or uninteresting by comparison. This is called desensitization, and I see it more and more in men over 60 who wonder why they no longer feel the same spark, even when their bodies are working just fine. There's also a psychological toll. Relying on pornography for gratification can gradually lead to feelings of guilt, isolation, or even dependence. Some men lose confidence in their ability to connect with a partner or begin to fear that their arousal won't work in a real-world setting. Breaking that cycle starts with awareness. It doesn't mean you have to eliminate adult content entirely if you don't want to, but it does mean being honest with yourself about how it's affecting your body, your emotions, and your relationships. If you've noticed that your desire feels weaker, your erections aren't what they used to be, or you're simply feeling disconnected from your sexual self, reducing your reliance on porn might be the first step toward real intimacy again. Many men are surprised by how quickly their natural sensitivity and interest return once they take a break. Now, we've talked about the mind and how it affects the body, but the truth is, the most powerful factor in your sexual health isn't mental or emotional. It's something far more basic, yet too often overlooked: your daily lifestyle. And what I'll share next may change how you treat your entire body, starting today. If you're still watching and finding these insights valuable, go ahead and comment the number 1 below. I'd love to know you're still with me. Let's keep moving forward now with point number 4, and this one might just explain why so many men feel disconnected without knowing why. 5. Your lifestyle equals your performance. When men think about sexual health, they often look for quick fixes, pills, supplements, or devices that promise fast results. But after decades in the field, I can tell you with certainty that the most powerful influence on your sexual performance isn't found in a prescription. It's found in your everyday habits. Your lifestyle, the way you eat, sleep, move, and manage stress, has a direct, measurable impact on how well your body performs, especially when it comes to erections and libido. The reason is simple. Your penis is part of a complex vascular system. Erections rely on healthy blood flow, balanced hormones, and good nerve function, all of which are shaped by how you live. If you smoke, you're damaging your blood vessels. If you're overweight or eat a high-sugar diet, you're raising your risk of diabetes and heart disease, 2 of the top causes of erectile dysfunction. Excessive alcohol use, that disrupts your hormones and dulls sensitivity. Chronic stress or poor sleep. That leads to fatigue, low testosterone, and a lack of interest in intimacy. On the flip side, just a few consistent lifestyle changes can dramatically improve your performance, even if you're in your 60s, 70s, or beyond. Start by walking 20 minutes a day, stay hydrated, eat whole foods, plenty of vegetables, lean protein, and healthy fats. Cut back on processed sugar and alcohol. Prioritize sleep. And most importantly, quit smoking if you still do. It's one of the most damaging habits to both heart and sexual health. It's never too late to start. I've had men in their late 70s reverse years of poor function just by changing how they take care of themselves. Not because they wanted to look young, but because they wanted to feel alive, connected, and confident again. Sexual health doesn't require perfection, it requires consistency and care. But beyond diet, exercise, and habits, there's one quiet behavior that almost no one talks about. Yet it could be silently damaging your erections every night while you sleep. It's subtle, it's easy to fix, and it could be the missing link in your sexual health journey. Let's talk about that next. Bonus tip: sleep without tight underwear. It might sound like a minor detail, but what you wear to bed or don't wear can have a real impact on your sexual health. Most men don't think twice about slipping into tight briefs or snug pajamas at night, but doing so can unknowingly put pressure on the penis during sleep, especially during natural nighttime erections. These spontaneous erections, which occur several times a night, are actually a healthy sign. They keep blood circulating through the erectile tissue, helping to maintain its elasticity and function. But when that natural process is met with constant pressure or restriction, it can result in small, repeated injuries to the penile tissue. Over time, this low-level trauma can lead to the development of internal scarring, what we call fibrosis, which may eventually contribute to Peyronie's disease. That's the same condition mentioned earlier where scar tissue causes curvature, discomfort, and even pain during erections. And the most concerning part? You might never notice it happening until it's too late. Many men assume their sleepwear couldn't possibly affect something as significant as their sexual function. But the truth is that small habits repeated nightly can quietly shape your long-term health. The fix is incredibly simple. Either sleep nude or wear very loose-fitting underwear, something that allows the penis to move freely without compression. It might feel unfamiliar at first, especially if you've worn briefs your entire life, but many men quickly find it more comfortable and refreshing. Some even report better sleep, improved circulation, and less irritation or sensitivity around the groin. This is the kind of subtle shift that won't show up in a prescription bottle or a doctor's office brochure, but it speaks to the heart of good health, awareness, prevention, and care. The smallest change can make the biggest difference when it's done consistently and intentionally. Now, you've heard the 5 essential ways to care for your penis, plus one powerful bonus tip. But more important than any single habit is the bigger message behind all of this. And it's something every man at any age deserves to hear. Let's wrap this up with a final thought that could change how you see your health from this day forward. Conclusion. If you've made it this far, it means you care about your health, your independence, and the quality of your life. That already puts you ahead of the curve. So many men, especially as they age, are told directly or indirectly that sexual health is something to let go of, to give up on, or to quietly bury under shame or silence. But I want to remind you, that's not the truth. Taking care of your penis is not just about sex. It's about dignity, confidence, and the ability to feel like yourself. We've talked about 5 essential steps: staying sexually active to maintain healthy blood flow, keeping daily hygiene a non-negotiable habit, avoiding the risks of sex with a semi-erect penis, limiting the mental impact of excessive pornography, and embracing lifestyle changes that support not just your erections but your entire body. And we added one extra piece, sleeping without tight underwear, to protect you during the hours when your body is doing the most healing. None of these steps are complicated. They don't require youth, wealth, or perfect health. What they do require is awareness and a decision to keep showing up for yourself even in the later chapters of life. These aren't just health tips. They're small acts of self-respect. They're signals to your body and your mind that you're not done yet, that you still care, that you still matter. I've seen men in their 60s, 70s, and even 80s reclaim their vitality by making these changes. And it wasn't about becoming someone new. It was about returning to who they really are without pain, shame, or limits. So if something in this message spoke to you, don't let it fade when the screen turns off. Take one step today, just one, then another tomorrow. Because real health doesn't come from one big moment. It comes from the choices you make each day to live with strength, honesty, and intention. And remember, it's never too late to take care of the man you've always been. If this message meant something to you, don't keep it to yourself. Share it with a friend, a brother, or a son who might need to hear it too. And if you'd like more honest, practical health advice made for men like you, hit that subscribe button and turn on the bell. This is just the beginning of what we can do together.